Good afternoon and welcome to our panel conversation, Challenges and Support for Caregivers and Older Adults in the LGBT community during COVID-19. My name is Juliana Valencia. I am a social services specialist with Fairfax Area Agency on Aging. Today's panel conversation will give us the opportunity to learn about the challenges that caregivers and older adults in the gay, bisexual, transgender, and queer community are experiencing during this pandemic, and really to help us understand why this time has been particularly difficult for them. We are going to hear from three leaders who will talk about what they are seeing, what lessons they have learned, and about some of the new initiatives they have implemented to address some of these gaps, as well as resources available to the community. Now, very quickly, I want to let you know that at the end of our conversation, you will have the opportunity to submit your questions to our panelists through the Q&A box on your panel. And a few housekeeping rules before I introduce our panelists. Today's presentation is being recorded, and a recording is going to be sent out to you by next week. Also, at the end of the presentation, there will be a quick survey. Please help us by giving us your feedback. Now, most of us are aware that even before the pandemic, the LGBTQ older adults dealt with social isolation and very limited support networks. Research has shown that LGBTQ older adults are 4 times less likely to have children and twice as likely to be single as their non-LGBT peers. Many of them are disconnected from their families of origin, and they rely on their families of choice for caregiving and for support, which it is a challenge within itself because often their friend networks are aging simultaneously. And most of the existing paid leave laws do not cover families of choice. Now, with that in mind, I would like to introduce our panelists. Our first panelist is Ms. Tara Davis Rama, who is the Diversity and Inclusion Program Manager for the Alzheimer's Association. The Alzheimer's Association was formed in 1980, and it is the leading voluntary health organization in Alzheimer's care, support, and research. Our next panelist is Aaron Tax, who is the Director of Advocacy at SAGE, which is a national advocacy and services organization that has been helping LGBT older adults since 1978. And our last panelist is Murray Shield, who is a senior staff attorney with Whitman Legal Services, an organization that has been advocating for the health, wellness, and dignity of LGBTQ individuals, families, and people living with HIV since 1973. Now, I would like to invite our panelists to introduce their organizations and talk about some of their services and challenges that they have seen during this pandemic in older adults and their family caregivers. Now, let's start with Tara, and then we'll move to on to Aaron and Murray.
Thank you so much, Juliana. Hello, everyone. Thank you. I'm excited to be with you today and just share with you some of the work we're doing at the Alzheimer's Association and with the LGBTQ community. As Juliana stated, I am Diversity, Equity, and Inclusion Program Manager for the Alzheimer's Association. I work all throughout the DMV, but the specific populations that I'm tasked of working with and making sure that we provide more education, resources, accessibility is Black and African Americans, Latino Hispanics, the LGBTQ community, the Asian community, and also the American Muslim seniors. The work that we do, I think it's incredible. Some areas that we are focusing more on is certainly within the LGBTQ community. The Alzheimer's is a form of dementia. There's no cure for Alzheimer's disease, unfortunately. Last year, this disease claimed the lives of 6.2 million people. And those are just known cases. By the year 2050, we're projecting that the number will be 14 million people that will be diagnosed with this disease. Unfortunately, the populations that I just named, they're at greater risk of either being misdiagnosed or being diagnosed with this disease. For the LGBTQ community, it's like 7.4%, 1.5 times likely to either be diagnosed or misdiagnosed with this disease. So a few things that we're doing in Montgomery County, we have LGBTQ health advisory committee, and we're working to see the needs of older LGBTQ individuals within the community and also surrounding communities, because people don't always have access to services in the communities that they live or their counties. So one of the things that we're looking to do is to provide support group services for the LGBTQ plus community that's led by someone who identifies as LGBTQ and for the community. I was introduced to this disease about 20 years ago. My mother was diagnosed with this disease, and despite us being told that they believe this is what the disease was, and they'll know for sure during her autopsy that we told my mother had this disease and that she was going to pass away from this disease, my family and I were scrambling for support, not just for my mother, but also for us. Fortunately, we did find support, but part of the support, at least my journey of it, there wasn't a lot of support. I identify as LGBTQ. I identify as the L in those letters. There wasn't a lot of support when it came to me. My sisters and my dad and other family members, real opening. They could talk about how not only this disease impacted them as it impacted my and their families, but when it came time for me to talk about it and share how it was impacting me and my then partner, the whole energy in the room would change, right? They would kind of just skate over it, but I didn't feel the support that I thought I needed. So one of the things I'm excited to do since I've been on board with the association is to make sure no one else feels that way. No other family member, no other caregiver, no other loved one has to experience what I experienced and what so many other people have experienced, and far greater than what I've experienced. So making sure that we provide services, whether they're for the caregiver or for the individual living with the disease, in the form of our early engagement program, memory cafes, but we provide a safer space, an inclusive space that we can help individuals deal with the disease. We have a plethora of programs that we do through the association. We do community presentations to caregivers, individuals with the disease, and to the community at large. We also offer support groups for individuals who are caring for their loved one, a child of a loved one who may be dealing with this disease. And then once again, we're making sure that we begin to incorporate and we create support groups for the LGBTQ community. So they're not feeling like they have to go through this journey alone. And if anyone is a caregiver, been a caregiver, know a caregiver, this is a tremendous journey, and no one should ever have to go through this in isolation or by themselves. In addition to that, we also offer care consultations for the family. And we want to make sure that we're offering care consultations that meet the needs of the family. It's not kind of a one size fits all. So making sure that we are really being inclusive of all the populations that we work with. The last thing I will mention is that the National Area Alzheimer's Association, we have partnered with SAGE, and we're committed to making sure that we provide services, not just to the individuals that we work with, the individuals that call our 1-800 number to get the help that they need, but also other organizations and agencies that are also partnering with SAGE as well, and that provide services to the LGBT community. I know I gave you a mouthful, but that's some of the great work that we're doing, and looking forward to hearing from the other panelists and hearing more from you. So thank you so much for allowing me to be with you today and sharing.
Thank you so much for that wonderful presentation, for telling us a little bit about your organization and the services that you're offering. So we have Aaron Tax from SAGE, who is on the phone with us, and we'll call him to be our next speaker to talk about his organization and some of the services and challenges that they have seen during this pandemic.
Sure. Can you all hear me okay?
Yes.
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 Excellent. Thanks so much for having me on today, and apologies for being on the phone. I'm on vacation, so I'm just phoning in. So in terms of I'll give you some background on SAGE, and then some of the issues we see facing LGBT older people, particularly during COVID. and beyond. So SAGE was founded in 1978, and we are the nation's largest and ironically oldest organization dedicated to improving the lives of LGBT older people. And we currently run a number of LGBT targeted senior centers in New York City. We have 2 buildings there targeting LGBT older people, one in Brooklyn, which is completed, and one in the Bronx, which is close to being completed. In addition to that, we have a cultural competency training arm called SAGE Care, where we train entities all across the country, whether they're aging providers, even LGBT serving organizations, on how to be more culturally competent and welcoming to LGBT older people in their communities. We run a federally funded National Resource Center on LGBT aging, which I suggest all of you check out, and has some really amazing resources on creating welcoming communities, on how to collect data, on how to provide culturally competent services and supports, so on and so forth. So there's some great resources there. And I do our policy work at SAGE, along with a coworker who does our grassroots advocacy and someone dedicated to this work in New York City, where we try to make sure that our federal and state and local aging policies are LGBT inclusive, and to the extent that we're advocating for LGBT inclusive policies, that they're inclusive of the needs of older people. And the primary legislative item that we're working on at the moment is something called the Equality Act, which is a comprehensive LGBT civil rights bill, which would protect people from discrimination on the basis of sexual orientation and gender identity in housing, employment, public accommodations, including explicitly renamed senior centers, jury service, access to credit, and under Title VI, which is federal funding. So that's our top legislative priority at the moment. And in this most recent Congress, we worked with allies on the Hill and allies around the nation to include some language under the Older Americans Act, which is the primary vehicle for the organization and delivery of social and nutrition programs in our country. And now, for the first time, it is federal law that every single state unit on aging and every AAA, including Fairfax, must now engage in outreach to LGBT older people in their community, collect data on their needs, and collect data on whether they're meeting their needs. So that was a big victory for us and for LGBT older people in the last Congress. And we're looking forward to working with the Fairfax AAA and all other AAAs and state units on implementing that language. In terms of the impact on COVID, in terms of the impact of COVID on the community, I think it really exacerbated the trends and the issues that we already see. So LGBT older people are twice as likely to be single and 4 times less likely to have kids than their heterosexual and cisgender counterparts. In addition to that, we see higher rates of poverty, particularly among lesbian couples, with twice the poverty rate of their heterosexual counterparts. And then on top of all of that, a lack of access to culturally competent services and supports. So although we see greater need for these services and supports because of the higher rates of social isolation and the higher rates of poverty, we also see the phenomenon of people being less likely to access those services and supports because of fear of discrimination and stigma over their life course. So what we try to do is bridge the chasm between that higher need and the lower rates of access. One other issue we see is folks going back into the closet as they enter a more vulnerable period in their life. And we try to help create welcoming agencies for that reason. In terms of COVID in particular, we saw it exacerbate all of these issues. So to the extent folks were already socially isolated, COVID made that all the worse. To the extent folks were reliant on families of choice, if your families of choice are not in your household, which is quite often, maybe they're friends who live down the street, or other folks like that, it was quite difficult to even interact with them. So that created a whole host of challenges. You know, for folks who are maybe renting out an extra room on Airbnb or driving an Uber or participating in the sharing economy, COVID made that all the more difficult. So we saw a host of challenges there. And in terms of a response to that, SAGE launched a program called SAGE Connect, which is still up and running, which is a way for folks to sign up to be called, to be checked in on a regular basis, and a place for people to volunteer to make those calls. And people can be anywhere in their country, either on the receiving end or on the calling end, which is really great. So I encourage folks to check that out. And beyond that, we adjusted the services and supports that we provide through our senior centers and case management in New York to make sure we are meeting folks in a virtual way. So all the programs that we are running in our senior centers, to the extent we could, we moved those online. So that gives you an example of some of the issues these folks face. and how SAGE is trying to address them. So with that, I think I'll pause, and then I'll be happy to take questions later.
Thank you, Erin. Thank you for giving us that information about some of the challenges that your organization has seen and some of the advocacy that you are all working on. And we'll get some time to talk about more about advocacy. So our next panelist is Maurice Schill, who is an attorney, and he's working with Whitman Walker Legal Services. So welcome, and please take it away.
Thank you. You can all hear me okay?
Yeah.
Yeah, great, good. So I, as was said, work for Whitman Walker Health Legal Services. Whitman Walker is a health clinic, a federally qualified health center in the District of Columbia that provides general primary care for residents of the DMV, the District Metropolitan Vicinity. And it grew up in part in response to the HIV epidemic. And one of the needs that arose during that epidemic was a need for legal advocates to help people who were very ill to apply for the benefits that they needed due to their illness, but were unable to get because their illness impaired them so much in the process. They also needed help with developing things such as powers of attorney, wills, and other documents in order to have their wishes for their own care followed out. So Whitman Walker created a legal services department, and I am one of the attorneys there. And we represent not Whitman Walker as a corporation, but we help Whitman Walker's patients and other members of the community with various legal issues arising out of their health or disability status or their LGBTQ status. So one of the main things we do is help people apply for and maintain Social Security disability income, whether that's through Social Security or federal civil service benefits or private disability. In addition to that, we help people with issues of discrimination that may arise in healthcare, possibly in the work setting, arising out of their LGBTQ status or their HIV status. We also now have a fairly robust immigration practice where we help people who are facing immigration hurdles due to their LGBTQ or HIV positive status. Another growing area for us over the last several years has been our transgender name and gender marker change program. We help transgender individuals update their government issued ID, such as birth certificates, driver's license, passports, and so on, to reflect their proper name and gender marker. We also help people apply for health insurance and maintain their eligibility for health insurance, such as individual policies on the exchange or Medicare, Medicaid, and other wraparound health insurance benefits. At times, we also help people with medical related debt. And one of the areas that I focus on most is the estate planning, which involves helping people to draft up a healthcare power of attorney, a general power of attorney, a disposition of bodily remains, or a last will and testament, or some combination of those, so that if they become unable to make decisions or follow through on decisions for themselves, there will be somebody in place who has the legal authority to step in to do that for them. And if and when they pass away, there's a legally enforceable will to dispose of their property in the way that they wish. So that's a very broad description of our what we do in Whitman Walker Legal Services, and I'd be happy to provide contact information for that. Over the course of the COVID-19 pandemic, probably our Whitman Walker's biggest initiative was the warp speed move into telemedicine, something which I think we'd been sticking our toes into for a little while beforehand, but had to fly into as quickly as possible. And we were fortunate to be able to serve basically at 80% capacity by the middle of the pandemic. In legal services, we moved to helping people by phone and email. One of the biggest problems that we faced in provision of our services during COVID-19 was the execution of documents. So many of these documents, in order to be legally enforceable, have to be signed in front of one or two witnesses, and preferably in front of a notary, which requires at least 4 to 5 people all being together in the same place at the same time. This proved to be quite a challenge during COVID, not insurmountable. We took to doing outside executions of these documents in people's backyards, on the sidewalk in front of our building, even in winter weather. We have now moved to doing those indoors. I'm glad to say. I would echo Aaron's observation that during COVID-19, all of the difficulties our clients faced with isolation were only exacerbated. Our clientele tend to have a greater rate of disability, physical or otherwise, and isolation. Many were going to congregate meal sites or other adult elder care centers on a regular basis for services. When COVID happened, all that shut down. One story I have in particular, a client of mine who was suffering from short-term memory loss, until the shutdown, was going every day to his local congregate meal site, where he would check in with the staff there. They would make sure he was doing all right, check and see whether he needed to recertify for any public benefits. They would take care of that for him. So he had engagement with others who supported him in maintaining his activities of daily living. He had a reason to get up, a reason to go out, and if he didn't show up, they would follow up with him. After COVID-19, he was alone in his home, and he started to deteriorate, and his dementia symptoms escalated. Fortunately, in his case, he had a very proactive adult daughter who stepped in to take care of him, and she and I and he were able to process an application for him to get necessary services. But he was lucky. Not everybody has an adult child or somebody who will be able to step in on that. So that really posed a significant problem for us, having somebody in place who could step in to act on someone's behalf in those terms. And also, we just struggled with how slow everything became in processing applications for benefits. So I think one of the other issues that our clients, especially our LGBT and HIV positive clients, fear is discrimination or stigma if they have to receive in-home care, or if they have to go into a nursing home. It's a big fear that they will have to recloset. That is something that we're trying to address with greater wraparound services. It's something that we're also advocating for on a broader policy level. So with that, I'll turn it back to Juliana.
Thank you, Mary. That was very insightful. And we'll have more time to talk about some of the discrimination and what policies we can advocate for to make sure that there is equal access. So my next question is for the three of you, and we can kind of go in the same order that we started. So my next question is, could you talk about some of the initiatives, and you all kind of touch on that, but could you talk about some of the new initiatives that your organization has implemented to meet some of these gaps, to address these gaps, especially for the LGBTQ older adults and their caregivers? So let's start with
I'm sorry, did you want me to start first, Juliana?
Go ahead.
Okay. So with the Alzheimer's Association, as previously stated, and what I didn't, talk about in my introduction, is also the impact that COVID has had on individuals, but also individuals living with this disease and caregivers. Most people normally, and Murray alluded to this, they're either going to different places, they're receiving different resources. They may have different people coming in and out of their home to assist them. Well, with COVID, all of that shut down, so that wasn't able to happen. And for individuals who are living with this disease or caregiver in the LGBT community, the impact was twice as hard for them, if you will, because they weren't able to not only go to places that they felt safe going to, but now some were just completely alone. Some didn't know where to turn to, who to turn to. So they were kind of navigating by themselves, or they were either at the house with the person that they were taking care of, instead of, maybe 5 hours a day, 24 hours a day. So what's that impact do for those individuals who are not used to being everything and doing everything for the individual? So certainly with the Alzheimer's Association and the community, we certainly, we're still seeing the consequences and the repercussion of individuals who are living with this disease, caring for someone with the disease during COVID. So some of the things, the initiatives is starting support groups. I mean, really having support groups that are led by someone in the LGBT community. And I'm not saying there's anything wrong with allies, but we really want individuals to feel like they have a space that they can go and they can talk about any and everything. Alzheimer's just doesn't impact the caregiver or the person, it impacts your entire life. It pulls on you in every single direction, every area of your life. So we want people to be able to share those stories. And, we realize within the community that the support we need is not always going to come from your family. So we want to make sure that in addition to providing the education and resources, that we're providing a space where people feel safe or comfortable. Early engagement is for the individual who has been diagnosed with the disease in their first stage, and having them to be in an environment, once again, where so many different things can happen during this period, right? They may, their memory may not allow them to remember who their partner is, right? Or that they're even gay. We hear these stories. We know that this happens. We want them to be able to be safe and feel comfortable and engaging, and just different activities that so many of our other memory cafe programs do. And then working with communities and organizations within the District of Columbia, within Virginia, within the different counties, area of aging, Montgomery County and Prince George's County, and providing training and resources and cultural competency and sensitivity to individuals who work with them. A lot of people will say, no, we don't have anyone in our facility that identifies as LGBTQ. Well, we know that's not true. For every facility, people may choose not to do so, and they may choose not to do so because of fear of stigma, fear of being treated, unfairly, or someone trying to make them think that who they are is wrong. And especially when you're vulnerable after a certain age and you're vulnerable with this disease, we want to make sure that we're providing education and resources to agencies throughout the different communities, that they're able to better serve and assist the LGBTQ population.
Thank you. So our next panelist is Erin. Are you still with us? So perhaps while we wait.
Yeah, still here. Sorry about that. Yeah, I think I would reiterate exactly what the previous panelist just said in terms of some of the challenges we faced during the pandemic, and the need to really step in and address the social isolation that we've been seeing. And unfortunately, I think for many LGBT older people, there is a limited number of outlets or spaces in which they can find community and be around other LGBT folks, which they find particularly meaningful and important. And at least at the beginning of the pandemic, those opportunities unfortunately dried up a little bit, and we really had to pivot and try to make as many of the programs that we had that were based on in-person interaction online as possible. And I think one of the silver linings that came out of the pandemic is that we saw that in some senses, moving online made some of these programs, services, and supports a little bit more accessible to people who couldn't always come into our senior centers. And one of the things that we're trying to do is figure out a way to continue that type of programming moving into the future. And I think that's certainly one of the silver linings that came out of this pandemic. And just for sake of example, if you have someone maybe who is confined to a wheelchair and might have trouble navigating around New York City and getting on the subway or getting on a bus to go to one of our senior centers, if now we have a support group for people coming out late in life or long-term survivors of HIV, and then they could finally dial into a program like we're doing today and get the support and services they need, that can go a long way to helping them. So we're certainly trying to figure out a way to make what seems like a temporary pivot into something permanent moving forward. I think that's probably the best example of what we're trying to do. And then there's that previous example I talked of, the Sage Connect program, which was, frankly, a long time pipe dream of Sage, to make some sort of kind of a version of what we have in New York City, which is our friendly visitor program, where people can sign up to visit homebound LGBT older people, but that wasn't an option for many people around the country. And what we tried to do through the Sage Connect program is give away or provide a way for people across the country to connect with LGBT older folks who might be shut in or who might not have access to a support network. And that's certainly something that came out of COVID-19 and that we will be continuing moving forward.
That is great. Thank you. So our next panelist, Murray, do you want to talk about some of the initiatives?
Sure. So there are some programs or services at Whitman Walker which have been around for a while, but we've, in the face of COVID, have had to expand significantly. So for some of our clients, particularly those who need a lot of support regarding their health care, we have a team of nurse care managers who will meet with a client on a regular basis, potentially a weekly basis. In the before times, and we hope will soon be the new times, meet in person, say fill pill boxes, check their blood pressure, monitor how they're doing, make sure that they get to their specialist appointments and so on. So that's one wraparound service. Also, Whitman Walker operates a number of support groups for people living with HIV, for older LGBT folks. We've had a program called Silver Circle, which is basically a series of groups for elder LGBT folk to support each other in various issues that arise as one gets older. And then for legal services, I think one of the advantages for us is that we're not necessarily chained to our desks or our dining room tables at home. I can actually get up and go to people. So if there's somebody who's isolated in some way, I can go meet with them in their home. And I've done that. I've gone and done home visits and so on to help out. So as I mentioned earlier, the greater use of telemedicine for folks. So I think that those are some of the things that we're trying to expand, build on what we already have, make it more flexible, and sort of be more attentive to those who are the most vulnerable. What I'd love to see in DC is a congregate meal site devoted specifically to the LGBT community that people could go to, kind of similar to what SAGE has in New York. I was very impressed with that when I visited it several years ago. It really had a sense of being home for the people who were there. I'd love to see something like that in DC as well. Thank you.
Let me ask you a quick question. So the services, the clinic and most of the services are in DC, but are they open to the north of Virginia, or is?
Yes, yes. So we have a number of patients who come from Northern Virginia, surrounding counties in Maryland. We have some people who come from far eastern Maryland or West Virginia for their care, particularly in the transgender community, because they don't want to go to a healthcare provider in their tiny community because they're not sure what could get around. So they'll come down to see us, and you know, we're happy to do that. We can see people from anywhere. And we also just get phone inquiries from all over the country. Anybody is welcome to come and get care at Whitman Walker. We're not just for the district residents. And we take virtually any insurance, private insurances, Medicare, Medicaid, other forms of insurance. So we can usually work out the payment scheme. And our legal services are free, so.
Okay. Sounds like it's very accommodating to the needs of the person. Yeah.
Try to be.
My next question is for Tara. So living with Alzheimer's and caring for someone who is living with a disease is not easy. And you have kind of talked about that, but could you go back a little bit and talk about some of those unique challenges that caregivers caring for someone with dementia are facing during this time?
Great question. Thank you. There are so many needs that an individual is faced with. There are needs that you would never even imagine that you would be faced with, just because you never know what the day-to-day will be like, right? One day the person could be having an amazing day, they're doing great, they remember you, they remember all of the cues, they kind of remember everything that you put in place to assist them and assist yourself, and then the next day it's just not there. So, you know, we have to, individuals who are caring for someone with this disease, you know, a couple of things. You have to understand this is beyond your control. It is the brain that is deteriorating. So the brain, you know, a lot of people will say, well, I think they remember. Sometimes I think they're just joking. We really wish it was that, but they're not. And as the brain begins to deteriorate, it really impacts the individual's way of living, their day-to-day routine, and you as the caregiver. So, you know, I encourage people, be flexible. Don't be so rigid. Call the 1-800 number, 800-272-3900 at the Alzheimer's Association. That number, someone will answer your call at 3 o'clock in the morning, 5 o'clock in the morning. Whatever crisis, whatever situation you're dealing with, you know, we offer programs that you can understand the different stages. In the beginning stage, how the individual will begin to change, how they'll begin to behave and respond. So at least you have something to kind of brace you for what's to come. And then there's the second stage where the individual, you know, they begin to deteriorate more because of what's going on in the brain. And we can provide you with strategies and tips and how to prepare yourself for that And then we have the final stage. So there's 3 stages to this disease, and the final stage is normally, you know, it's so incredibly difficult, not only for the individual with the disease, but for the individual who's caring for that loved one. So we offer those resources to help you to be able to embrace. We can't address everything. We wish we could, but we can't. But we want to be there to assist you in as many ways as possible. No 2 people living with this disease is the same. Some people will say, oh, well, you know, my spouse, you know, they behave this way, so just try this. It may not work, you know, it may not work at all. So just making sure that you are in tune to what's going on, you're getting all the assistance you need. And, you know, especially for the LGBT community and anyone who's caring for someone with this disease, but especially for the LGBT community, make sure you have a support group. And that support group, as we know, is not always going to be your family member. It could be someone in the community. It could be a neighbor. But make sure you have a support network, because you cannot do this work alone. You cannot care for an individual by yourself. And a lot of times it takes a toll on the caregiver. And a lot of caregivers will become sick. Some caregivers have passed away before the individual who's living with this disease. So make sure that you get the support, make sure you get the resources, the 800 number, 272-3900 to the Alzheimer's Association, 24 hours a day. Make sure you look into our resources, you visit our website. And also, you know, last thing I will say is just be okay with not being okay. There's nothing you can do. There's nothing you can say. There's not, oh, if I had been there this moment. None of that, unfortunately, as harsh as it may sound, it's not going to change anything. But please take care of yourself in the midst of caring for your loved one or someone with this disease.
And I would echo what Tara is saying by adding, let good enough be good enough. You know, some people are perfectionists in care or whatever. That's going to take a terrible toll on yourself and the person you're caring for, because you're going to have to include other people in the care, and they may not necessarily do things the way you would do them, or you need to let good enough be good enough.
I like
Great
that.
point, Murray.
Yeah, yeah. So my next question goes to Aaron. And Aaron, we kind of have talked about this as well, but even before the pandemic, you know, social isolation was already a concern for a lot of older adults and a lot of family caregivers, but especially for the LGBTQ community, this can be more prevalent. So how has loneliness and isolation impacted older adults and caregivers in the LGBT community, at least from your professional experience, from what you've seen?
I mean, it's certainly taken a toll on folks, and I think we heard, you know, from tons of people during the pandemic, even younger people like myself or other people, who have more access to technology and easier access to friends, that social isolation took a toll. And I think we saw that in a more pronounced way among LGBT older people who are traditionally reliant on these more in-person forms of social interactions and more reliant on families of choice. And, as I mentioned a little bit earlier, a lot of those opportunities and those resources and those support networks took a hit. They dried up during the pandemic, and people were not able to access those social networks in the same way. And, we did our best to try to address that. We had people volunteering to check in with the people who typically go to our senior centers. So they were making upwards of several thousand calls a week. I volunteered to do just a handful of those at the beginning of the pandemic. And that takes a lot of people power and a lot of time and resources to, basically manually check in that way. And, one of the themes we also heard from some folks is how this was a little bit reminiscent of the HIV, or the height of the HIV/AIDS epidemic, and just brought memories back of that time in a way that was difficult for some people. So I think that's another unique thing about the LGBT community and the shared history of facing another, I don't know if the technical term is right, another pandemic or another epidemic that had, that resonated with some people. So there was a whole host of challenges. And of course, folks who are LGBT people of color, Black LGBT older people, trans folks within the community struggled, often, more so than the rest of the LGBT population who might have had more resources at hand, to address some of these challenges.
Yeah, thank you. So my last question, and after this, I would like to invite our audience to submit your questions, to please type them into the Q&A box. And after my last questions, I will start reading yours for our panelists. So please, you're welcome to send your questions. So my last question is for Murray. So for people who, might find themselves facing discrimination when accessing or when trying to access healthcare services, what are some of those rights that they need to be aware of? What can they do?
Right. So, and I assume you're referring to discrimination based on LGBT status or
Right.
HIV. Right. So, a little bit of history on that, and Erin can help me out here. But the Affordable Care Act, Obamacare, one of the provisions in that massive piece of legislation was a provision that prohibited discrimination on the basis of sex. And the Obama administration, in its rulemaking to interpret the law, said that sex included gender identity and any discrimination based on failure to conform to a gender stereotype, i.e. on the basis of being lesbian, gay, bisexual, any sort. And some people may have heard that during the previous administration, there were efforts to roll that back. The rollback has been rolled back, and the Biden administration has now said that unambiguously that it considers the prohibition against sex discrimination to include prohibition against discrimination in healthcare on the or insurance, health insurance, on the basis of LGBTQ or HIV status. So there is a statutory protection in the Affordable Care Act against that kind of discrimination. And if you are facing some sort of discrimination in healthcare on the basis of LGBT status or HIV status, you're welcome to reach out to us. We personally may not be able to assist you, but we would do everything we could to get you into the hands of people who would be able to assist you. So, for instance, there's another sister organization, Lambda Legal, which a couple of years ago represented a lesbian woman who entered a nursing home and faced terrible abuse from a resident without any intervention on the part of the nursing home. And the courts, it was undisputed that that she was protected against that sort of discrimination, that the laws against discrimination on the basis of sex encompassed on the basis of her status as a lesbian. So we'd be happy to hear from you if anything like that has occurred to you. And I'd be happy to pop into the chat box our intake number and email address if this would be a good time to do that.
Absolutely, and you can also email it to me if you want to, and I can send it out everyone who registered as well. Let me ask you this. Do people have to be a patient of Whitman Walker Clinic to be able to access the legal services, or if they or is that not a requirement?
Not a requirement. So for legal services, you have to fall into one of three categories. You're either a patient of Whitman Walker, you identify as lesbian, gay, bisexual, transgender, somewhere on the spectrum of LGBTQ. You're HIV positive. That tends to be our catchment area. If you have some issue, though, where you really need some help and direction, and you may not fit neatly into one of those boxes, just give us a call anyway, and we'll try to get you connected to somebody who could help you. So we just don't want people flailing without any sense of direction. There are a number of legal services organizations in DC and in the surrounding areas that may very well be able to assist you. So, and I'm putting this in here. Walker.
Thank you.
Sure.
So while you type that,
yeah,
I have a question for Tara.
Yeah.
One of the questions says, are there caregiver respite services for caregivers of people with Alzheimer's? And I would imagine this comes for specifically for the Alzheimer's Association in terms of services.
Yes, we don't provide those services, but we can provide you with the names of the services, and we ask that you just, look into them yourself, because we don't want to say, oh, this place is amazing, and you think the complete opposite. So yes, we can provide you with names and resources within your county or where you're located, so you can, look into those places yourself. But yes, there are places that offer respite for individuals who have Alzheimer's or other forms of dementia.
Okay, great. So my next question, and really this is for all of you, what are some of the lessons that you've learned from this pandemic? I don't know, Aaron, would you like to start? Maybe we have lost him.
I'm back. Sometimes it takes me a second. Sorry about that. I think, it's easy to focus on the negative parts of it or the really difficult or challenging parts of it. But I think the other thing that we could look to is the resilience of the LGBT community and the resilience of LGBT older people in particular, who've, certainly gone through a lot in their lives, whether that's the stigma and discrimination they faced over the life course, or, as I mentioned or referenced a little bit earlier, the HIV epidemic, and so many challenges. And I think they really, rose to the occasion here in terms of banding together and reaching out to each other, and the LGBT community did its part in reaching out to the older adults in our community. So I think there's also, this really good and powerful story here of the way communities can come together and overcome challenges.
Great, thank you. Merit, would you like to talk about some of the lessons?
Lessons learned. Yes, so I would echo the Aaron's comment on resilience. What I've learned is we need to craft and pass legislation that will make it easier to execute estate planning documents remotely. When we were in the height of the epidemic, I was on Zoom calls with colleagues in this. How are we going to do this? Oh my God! Well, maybe the client can hold up a phone, and the two other witnesses can watch them sign, and then we send the document off to the. It was crazy. So figuring out a way by which documents can be signed virtually, have a virtual presence, is one very nitty-gritty, wonky lesson that I've learned throughout all this, and simply the importance of being flexible. And I also echo Erin's a comment that a lot of us were saying to each other, boy, it's like the early 90s again. You know, taking care of people or hearing of people passing, just sort of the trauma and the fact that because of the circumstances, we couldn't lift up those lives or mourn together or in person. You know, I had a client pass away, and I don't know. I couldn't be at the funeral. There was a lot that I couldn't do, and it was that that was really difficult for me. So I think that it would be important for us not to let COVID-19 go by without having learned from it in the event that we face something similar in the future.
Very well said. Thank you. Tara, would you like to add some of the lessons that your organization has learned, or even that you have learned in this profession during this pandemic?
Yeah, I think definitely being more intentional in the work that we do and what we do, and that we don't just, you know, do the planning, but we really implement it. Not, you know, we'll get to it, but being really intentional and working with the community, working with the population, understanding the needs and the role of the caregivers, really hearing from them. You know, not just saying, oh, this is a group that we provide services to, but I mean, we really have partnerships, intentional, specific, clear-cut partnerships with the LGBTQ community, that we're providing the services and care and the resources that they need. And they're so comfortable in picking up the phone and calling us or navigating our website without any fear of stigma, shame, judgment, or any of those things. And just also working with organizations, agencies within the communities, that they too offer that same type of openness and welcomeness, and being intentional about serving the needs of the LGBT community.
Thank you. We have a quick question, and I mean, you're all welcome to answer it, and we can start with Tara Murray, and then we'll go to Erin. But the question says, I know there's a lot of research about using robotic pets for older adults to help with social isolation. Have you had experience with or exposure to this? I don't know if anyone could offer an answer to that question.
Well, back when we were doing programs in assisted living facilities and care facilities, there were several that they had pets that lived right there in the facility. They had a couple of dogs and some really huge cats that you would mistake for a dog, but you would just see the individual who would, you know, once the dog came to their room or to their area, I mean, just so different. They were so different. They would light up. It would just change their mood. Some would begin to sing, and, you know, something about animals are just amazing. You know, personally, my wife and I, we got a dog at the beginning of the pandemic. We said, oh, we're home, we're working from home, we'll have time to take care of the dog. Well, we're in Maryland, and in Virginia, our nephew, who's in high school, very gifted young man, was really struggling and became very depressed. So one day he came over, him and his mom, masked up, and he began to play with Amber, and we just watched how he just completely began to change. So the next week we gifted Amber to him. He's the young man that we know before the pandemic. So do pets help? Absolutely. Absolutely.
That's a very sweet ending to our panel conversation. Thank you so much. So we are ending now our panel conversation. And as I mentioned earlier, there will be a brief survey as you signed out. Please take a moment to answer those questions, because it really helps us provide topics that you are interested in. I also want to thank you, our panelists, for being here today, for giving us an hour of their time. Aaron is on vacation, and yet he's still with us. He's here with us. So thank you so much. I truly appreciate your time, for all of you as well. And I also want to thank our attendees who are here. So thank you for your great questions, for your participation, and I hope you all have a great weekend, everyone. Take care.
Thank you. Thank you so much for the
Bye-bye.
opportunity.
Yes,
You take care.
absolutely. Bye-bye.
You too.
Bye.
Bye-bye.